Dr. Shivangi Trehan. You're speaking on central macular thickness changes after SICS and OCD-based pilot study.
Good evening, sir and ma'am. My topic is central macular thickness changes after SICS and optical coherence tomography-based study. So cataract, as we all know, remains one of the leading cause of blindness worldwide, and the cataract surgery is among the most frequently performed surgical procedures. Cataract surgeries are the most common, and the changes in the macular thickness is one of the late complications that may lead to vision deterioration. Pseudophakic CME, known as Irwin gas syndrome, is a complication of cataract removal and IOL implantation. It occurs as the prostaglandins released due to surgical trauma leads to the breakdown of the junctional complexes in the parafoveal region, and the fluid starts accumulating in the intercellular spaces, leading to the formation of cyst. It is often self-limiting. So in our study, we have taken OCT, which is the medical diagnostic imaging technology, from which cross-sectional images of the retina are obtained at the resolution of 10 microns, and we have used it to measure the central macular thickness. The aim of our study is to study the incidence of CME in unevenful cases of SICS, and the objective is to determine changes in macular thickness following unevenful cataract surgery and to elucidate the optical tomographic features of macular thickness after unevenful cataract surgery. It's a hospital-based cross-sectional study with 258 patients, and the inclusion criteria were clinical diagnosis of cataract willing to undergo surgery, any cataract that allows OCT, and uneventful SICS with posterior IOL implantation. These were the exclusion criteria, basically patients with diabetes, hypertension, glaucoma, complications during surgery. We had the methodology. First, we had the preoperative, written and informed consent, along with BCVA was taken, then followed by IOP, then patency of NLD with slit lamp examination, biomicroscopy, and OCT was done. This was the preoperative OCT macula image. Then peroperatively dilatation was done, then periverbal block, SICS performed with IOL implantation, then duration of the surgery was noted, and absence of any complications was also noted. Post-operatively, we saw the BCVA with slit lamp examination, biomicroscopy, and OCT was done. So this was the OCT of the patient after operation. So the observation that we found that the preoperative mean macular thickness was 217.42 microns. And post-operatively, we saw on first, second, fourth, sixth, and the 12th week. So the first week was 221, then second week was 222, fourth week was 223, sixth week was 226, while on the 12th week, it retained back to 219. So in 258 patients, the subclinical macular edema was seen, and these temporal changes were statistically significant. So basically, the study demonstrated that the SICS is associated with the transient increase in CMT, which peaks at 6 weeks post-operatively and returns to baseline by 12 weeks. The transient increase in CMT was not associated with any clinically significant macular edema or deterioration in visual outcomes, which indicates that routine monitoring is sufficient in uncomplicated cases. And the study also highlights the importance of regular follow-up and OCT monitoring, recognizing the natural course of CMT changes following cataract surgery, which can aid in clinicians in distinguishing normal post-operative findings from early pathological changes which require interventions. Thank you.
So what is the cause of CMT in this SICS?
So basically, since SICS, we are making a tunnel. So prostaglandins are getting released. So these prostaglandins, as there are two ways. So either they break down the blood-retinal barrier, blood-aqueous barrier, and then they cause the inflammation, or they directly enter the posterior chamber, and then they cause the inflammation, which leads to the macular edema.
So this is absolutely a temporary.
Yes, sir, absolutely a temporary thing. But as we know, the Irwin gas syndrome, that leads to deterioration of vision, usually by 2 lines of Snell's chart as per other studies. So that requires our intervention by, we can give flurbiprofen we can give, that decreases the edema in that, if
So
Irwin gas is
only
found.
the medical treatment is sufficient to.
So in the cases we found the macular edema, flurbiprofen was more than enough for the patient to retain the back to 6/6 of the vision.
You mentioned about the OCT monitoring
Yes.
later on. So for how long you were monitoring with the OCT?
Sir,
Was it feasible to do regular OCT with the patients?
Sir, most of the patients, since we only took 258 patients in 18 months, so these were the only patients who came to us for follow-ups for first, 2nd, 4th, 6th, and the 12th week. Otherwise, patients were not coming at the exact interval when we called them, but most of the patients came.
Now, if patient is coming up diminution of vision, then you will go for ECT.
What is the point in going for a OCT where there's not significant change from 217
Okay.
to 219, in between going to 222, 222, figures? So do you think is that a significant macular edema?
No, that's not significant, sir. That is not significant. Basically, we wanted to see if any significant edema was found in any of the
So
patients.
what did you gather from your study?
Sir, we gathered that we will only one patient out of 258 was found with the clinically significant macular edema. Rest all had no significant edema, but that one patient was also found because we did regular monitoring for the rest of those 258 patients. Otherwise, that one patient would also have been missed.
Not necessarily miss if the
If the
patient
vision,
would definitely come down with a decreased
vision. Yeah.
So
But
you can't say it's missed.
yeah.
Dr. Shivangi, all these patients were operated by the same surgeon?
Yes, ma'am.
By the same surgeon.
The same
Anything to
surgeon.
do with the surgical time?
Ma'am, surgical time was noted, but it was not in correlation or it was not statistically significant with any of the edema which was found.
Macular edema can be seen by slit lamp biomicroscopy also.
Yeah.
So what? Maybe that was a thesis topic that was allotted to you?
Yeah,
That's
yes,
it.
ma'am. Yes, ma'am.
But OCT can tell you the exact, madam. If you are seeing with the 90D, it will not give you the exact how much.
Sir,
thick.
exactly, but a significant macular edema.
Yeah, significant you can notice.
Hardly few
Yeah.
microns, we cannot pick
Yeah,
them
yeah,
up
yeah.
by naked eye. But
Yeah, yes, ma'am.
basically, all these residents are going for the OCT rather than for the clinical evaluation.
Right.
Just wanted to
Yeah, yeah.
emphasize on that point.
Okay, thank you.